Hello, my name is Jessie San, and I'll be presenting my research, How Adverse Childhood Experiences Lead to Chronic Outcomes. It was originally titled The Biological Effect of Childhood Trauma, but after further research, I found out that the technical term of it would be Adverse Childhood Experiences and how it leads to chronic outcomes, but the topic is still the same. A literature review that I did was regarding these 5 journal articles: Relationship of Childhood Abuse and Household Dysfunction to Many of the Leading Causes of Death in Adults, the Adverse Childhood Experiences Study, Children of Misfortune, Early Adversity and Cumulative Inequality in Perceived Life Trajectories, Disease Burden of Adverse Childhood Experiences Across 14 States, Adverse Childhood Experiences in Chronic Medical Conditions, Emotional Dysregulation as a Mediator of Adjustment, Safe, Stable, and Nurtured Protective Factors Against Poor Physical and Mental Health Outcomes Following Exposure to Adverse Childhood Experiences. And I know that these titles are rather technical, so I've broken them up into how I feel they form the foundation, effect, and impact on adverse childhood experiences. So when it comes to adverse childhood experiences, this research seeks to address the effects of how ACEs, such as abuse, trauma, household dysfunction, such as divorce, these could be emotional abuse, sexual abuse, physical abuse, and having such histories of adversity and how it shows that health outcomes are related to having a history of ACEs. And then I go into what can be done to intervene with the long-term effect of ACEs. So I begin with the foundation, or the Adverse Childhood Experiences Study. This was conducted by Folletti in 1998, and it is cited in numerous of my other journal articles in this presentation because it was the founding and the beginning of looking into how having a history of abuse and household dysfunction correlates with adult outcomes in health, such as quality of life, healthcare utilization, and mortality. They looked for these correlations in regards to risk factors and disease conditions, and these included smoking, obesity, physical inactivity, depressed mood, suicide attempts, alcoholism, drug abuse, parents that have drug abuse, and a lifetime of sexual partners, numerous sexual partners, and history of having sexually transmitted disease. And so these would be more correlated to the behavioral aspects of having ACEs, behavioral outcomes, and it also goes into more biological outcomes, including heart disease, cancer, stroke, bronchitis, COPD, diabetes, hepatitis, jaundice, or any skeletal fractures. In total, there was 9,508 respondents, and they included 8,056 respondents in their sample, since some did not qualify. The categories that they were looking into included childhood abuse, such as psychological abuse, physical abuse, and sexual abuse, as well as 4 categories of household dysfunction, including substance abuse, mental illness, violent treatment from a specifically maternal figure, such as a mom or stepmom, as well as criminal behavior. So there were strong correlations from exposure to ACEs and negative health outcomes. Higher amounts of ACEs resulted in higher prevalence and risk in regards to smoking, obesity, lack of activity, depression, and attempts of suicide. They also found a correlation to a higher prevalence of alcoholism, substance use, STDs, and having multiple sexual partners. An example of how the statistic was represented includes how only 1% of persons with no childhood exposures had 4 or more risk factors: heart disease, cancer, chronic bronchitis, or COPD, history of hepatitis, jaundice, skeletal fractures, and poor self-rated health were correlated in a dose-response relationship with having a history of these adversities in childhood. Those exposed are often exposed to more than one, and thus causing things such as a cumulative effect, meaning the more ACEs you have, it ends up causing more long-term outcomes for these individuals. Here I've provided a graph from the research that shows how adverse childhood experiences leads to early death. And the reason that Folletti talks about in his research is how it is suspected that due to instant gratification from things such as consuming drugs, alcohol, smoking, overeating, and having sex, due to their instantaneous pleasure, leads to the problematic behaviors that can cause long-term health outcomes. The children are subjected to lots of mental health obstacles like anxiety and depression, and thus they seek out methods to cope with it. And these methods to cope may not be necessarily helpful to how the long-term outcomes of their health end up deteriorating. As later health outcomes become apparent, they are viewed as irrational for having done drugs and smoking, as people in society view them as people that can make bad decisions. But in reality, they may just be finding a way to cope with the adversities in their early life. The next topic that I'll be going into is expanded research. Adverse childhood experiences and chronic medical conditions, emotional dysregulation as a measure of adjustment. This is the article that I'll be tying into this topic. The examples of chronic medical conditions that are included in this study are cancer, asthma, diabetes, allergies, and it's noted that there's rising rates of such diagnoses and survival, as well as causes for long-term adjustments and stress for families and individuals involved. When it comes to chronic medical conditions, this research focuses on including chronic medical conditions into a form of ACE. And this is to say that the ACEs that were originally encompassed in Folletti's research may not be all-encompassing of the types of obstacles that children may be facing. They note that oftentimes medical conditions are kind of separated from psychological conditions, but research actually suggests that medical conditions may actually be a form of stress, which could as well align with the effects of ACEs. So they focused on how pediatric CMCs as a type of ACE. The medical conditions, as I had mentioned, may increase risk for psychological distress and actually be a pathway similar to how other ACEs work. It consisted of a study of 348 students with chronic medical conditions, as well as 1,563 without chronic medical conditions. When it comes to emotional dysregulation, it's correlated with anxious factors such as anxiety and panic, vestibular sensations, somatic control, gastrointestinal muscular sensations, as well as depressive factors such as somatic depressed affect, positive affect, and interpersonal problems. Emotional dysregulation is the inability to identify and regulate one's own emotions, and they note how this creates a lot of chronic stress, which can take a toll on brain development and self-regulation. Early adversity and chronic stress may affect typical development of emotional regulative strategies, which contributes to maladaptive coping strategies in adulthood. As I had previously mentioned, people with ACEs tend to adopt rather harmful to their health behaviors to cope with that stress. It's also related to having an ACE and a chronic medical condition was found to actually be affect the ability to emotionally regulate. And having emotional dysregulation was a significant mediator of all relationships between ACEs and depressive and anxious symptoms, as well as chronic medical conditions in regards to depressive and anxious symptoms as well. So here I provided a chart of how the chronic medical conditions and the ACEs lead to emotional dysregulation, which lead to the other health outcomes that I had mentioned. And this is largely due to maladjustment because they're unable to cope with that stress and unable to kind of function with that anxiety and depression that comes with their diagnosis. So it's noted that CMC may actually be especially strong ACE. And ACEs and CMC diagnosis may induce chronic stress to a child's developing brain, thus resulting in hypothalamic, pituitary, and adrenal axis dysfunction and emotional regulation difficulties. Household members are also experiencing distress, and so they are less able to model and take care of their children and show them how to properly regulate their feelings. The next topic that I go into is distance. And when it comes to distance, I did the disease burden of ACE across 14 states. ACEs create a allostatic load that can lead to changes in neurological, immune, and endocrine and genetic regulatory systems, resulting in negative physiological effect on health. And this goes back into how adrenaline and cortisol affects all body systems and causing chronic issues with stress and heart rate, blood pressure, eating habits, sexual reproduction, and metabolism. This causes a lot of changes in child development of the brain and their ability to kind of emotionally regulate with the stress, and an overactive stress result can lead to an executive functioning difficulty, impairment with executive functioning, difficulty forming healthy relationships, and increased risk behavior. And it also talks about how adopting coping mechanisms that can be detrimental to health outcomes, which I had mentioned in my previous two sources, and focusing on understanding ACEs from the data of multiple states to understand the larger impacts of ACE. And this combines multiple different states and locations and their regards to information on ACE, including California, Washington, D.C. They didn't specify exactly which 13 states were pulled, but it is by the CDC's behavioral risk factor surveillance system. The total responses were 110,076 respondents, and from the 13 states that they had mentioned, and the 22,476 respondents from the California study. It is recognizing that environmental and socioeconomic variations throughout the United States, as well as education and employment, can influence the ability to access health assistance. And sometimes when you call a respondent with cell phone only access, they tend to have not as much access to health insurance, stable employment, and higher education. So this takes into more of the location aspect of ACEs. So more ACEs are correlated with lower educational level and unemployment rate. Higher amounts of ACEs connected with smoking, drinking, obesity, depression, asthma, inflammation of joints or arthritis, and COPD. Lifetime smoking and drinking was 1.6 times as high among those with 4 or more ACEs, as well as the prevalence of obesity, prevalence of asthma, arthritis, COPD, depression. Those all had more than 1 times as high prevalence when you have 4 or more ACEs. There's also noted that some locations tend to emphasize the effects of an ACE, like in Washington, D.C., where pollution may be the reason for a higher chance of asthma. So some of the things that they talk about are how smoking is 186% of the odds that were calculated here, 186% in California and 207% in the 13 states, as well as heavy drinking, obesity, asthma, arthritis, and very notably depression. In regards to your health odds, when you have 4 or more ACEs, there's a 400% chance in California and a 365% chance in the 13 states. Lifetime effects on immune systems due to stress cause problems with inflammation and your immune reactions, and your brain and your immune system respond to stress as well as premature cellular aging with physiological effects on bodily functions, including blood pressure, heart rate, and metabolism. So next, I'll go into perception, and this takes a more sociological approach when it goes into children of misfortune, early adversity, and cumulative inequality in perceived life trajectories. And this one talks a lot about how people are aware of their position within various status hierarchies and develop expectations for their future that ultimately shape the form of subsequent life trajectories. While we're looking at these previous researches, it talks a lot about how people going through histories of adversity lead to a future of health outcomes. Well, this one talks more about how the children of misfortune themselves may picture and envision their own adversity and how their understanding of their situation may shape their future. They talk about how economic hardship correlated with higher risk of death from stroke or stomach cancer, as well as the father's level of education and type of housing may correlate with higher levels of death, as well as household dysfunction related to mortality as well. ACEs have resulted in outcomes of physical and mental consequences, as well as difficulty transitioning into adulthood, a higher chance of being a criminal, and a larger chance of incarceration. And it will also have an effect on human, social, and health capital. So obviously people that have gone through ACEs will be having a situation, not just health-wise, but also socially and economically, they may not be in the best position. And so they talk about how biographical structuration is how events from the past will have an effect on how the present a person and how they envision the future, and how that structure may not be always within the person's control. People experiencing high levels of childhood adversity tend to believe that things are getting better, which is actually a surprising finding for me. They picture the idea of redeeming themselves and how they can improve themselves and grow, and this really helps with psychological adaptation. Biological structuration shows that individuals will continue to be affected by the ACEs of the past and may cause to further the inequality already present. Accumulation of ACEs has an effect with life trajectories being less buoyant for persons experiencing a lot of adversity, which kind of talks about what I had mentioned previously about how adversity is kind of cumulative, because people who experience one adversity tend to experience multiple. And lastly, I'll be going into prevention. Safe, stable, and nurtured protective factors against poor physical and mental health outcomes following exposure to adverse childhood experiences. And this study goes into how we can take as a society a way to help the people with ACEs and how we can contribute to kind of overcoming those effects that had been caused by ACEs. They talk about the idea of resilience. Promotive factors are positive situational, social, or individual characteristics that have the potential to interrupt a negative life course. The two things are mentioned specifically: assets, things within an individual that builds resilience, as well as resources, things outside an individual to build resilience. So an example of assets would be personality, characteristics, things that are resilient within themselves, and things that are resilient outside themselves. Resources would be like a socially supportive community. ACEs may activate toxic stress hormones in the brain, disturbing healthy brain development in children and negatively affecting lifelong health. So that goes into child development, as well as researching the idea of resilience to work against the negative effect of ACEs is the focus of this study, and how protective factors model, which is how presence of assets and resources can promote resilience and modify the relationship between risk, such as ACEs, and negative outcomes. So they kind of go into how having an adult figure, a caring adult figure that makes sure all needs are met, are able to help overcome the effects of ACEs. So safe, protective, equitable environment plus health development of social and emotional competencies kind of validate the idea of being able to interfere with the effects of ACEs. There were 7,079 respondents. So when it comes to protective factors, an adult that keeps a child safe, social support, a safe, supportive neighborhood, a safe, stable, and nurturing relationships, which is SSNRs. They promote the development of healthy social emotional competencies and their role in creating a safe, protective, and equitable environment. So the CDC actually recognizes that having those SSNRs are good for treating child maltreatment, and suggests that the presence of SSNRs can moderate the effects of maltreatment and ACEs that may have already occurred. Many respondents reported having a good caregiver actually, but they also noted that respondents with many ACEs do tend to report poor health and mental stress, and if they have many ACEs, they are less likely to have a caretaker that meets their needs and keeps them safe. Respondents with a good caretaker report good health and low moderate mental distress. So if the respondent has a caretaker that takes care of them, ensures they're safe and loved, then they do tend to report more good health and less mental disorders. And if they do have 4 or more ACEs, but they had a caretaker that protected them and met their needs, they also reported less poor health and less mental distress. So here I've included a little section of the questions that they asked their respondents. ACEs may be actually intergenerational, passed on from parent to child as they're kind of going through and coping with those adversities of the past. The potential to break the cycle of childhood trauma is also really important of kind of understanding how we can interfere with this cycle. Larger impacts of a caregiver being safe and protective towards a child than just meeting their basic needs, and helping. So if they were caring and protecting of the child, it has more of a beneficiary than if they were just meeting their basic necessities. And these can help with understanding how to help people with ACEs and how to deal with the long-term effects. So in conclusion, ACEs have an extremely large and widely research-supported effect on health outcomes on individuals, particularly negative health outcomes, including chronic conditions. Trends can be seen throughout the United States, as demonstrated by the 14-state research. There may be more ACEs than are currently considered, as that research I tried to include chronic medical conditions into an ACE, and it can be mitigated with emotional regulation, such as how you picture your life and your adversity, as well as having loving caretakers. Here's my works cited page, and thank you so much for listening to my presentation.